So in routine dentistry, working with the existing bites is often the best option for most patients. Okay. But if the teeth come into contact with each other in an unbalanced position constantly, and it's unbalanced in 6 dimensions, anterior, posterior, the pitch, yaw, roll, rotation. If they keep coming together in an unbalanced position, the muscles and jaw joints are affected in some patients. And in some of these patients, it causes headaches, neck pain, TM joint noise, ear problems, tooth wear and clenching, and postural issues. And there are many causes of unbalanced bite, from unbalanced dental treatment to breathing or allergy issues during child development. Now, when you look at this, do you think it's the mouth of a nose breather, mouth breather? What do you think, most likely? Mouth breather. Why do you say that?
Narrow maxilla.
Yeah, yeah, sure. And where's the tongue usually in a mouth breather? That's right, that's right. So it's amazing. Breathing has so much to do with how we develop, Obviously, thumb sucking. Old dentistry that's broken down or worn out, shifting of teeth after tooth loss, and also some types of ortho treatment. Okay, so coming down to the jaw joints. In a normal jaw joint movement, you see the joint in maximum closing where the teeth are together. The muscles that hold it, if it's in a nice centralized position, the jaw joint is actually, the condyle is actually seated in the cartilage, and it's balanced. And the muscles that hold it in place are balanced. The medial pterygoids, lateral pterygoids, they're all balanced. And if they're in the central position, both sides are balanced with each other. Now, what happens in an abnormal jaw is, or rather an abnormal position, say in someone who has bruxed all their teeth down, they're much shorter. So now they're biting further up. Okay, the teeth are shorter, so when it bites further up, it rotates backwards a little bit. So it's now in a posteriorized position. It's pressing now near onto the ear canal. It also is not in the center of the articular cartilage anymore, and that's where the clicks come. Okay, because it clicks back onto the cartilage. And over time, as you know, cartilage does not regenerate. It starts to wear down and wear thin. So when someone has a clicking jaw, even though it doesn't hurt, doesn't mean it's all great. It's degenerative. Okay. So this is actually the extended symptoms that we see with people who have TMJ syndrome. Everything from jaw joint issues to ears to vertigo, tinnitus. So these as whole, I think, we have to look at things as a physician, seeing what the problem is, because what you might find, and patients won't relate this, they won't have any clue that it's even related. It's our job as a practitioner to recognize these. If they're really worn down their teeth, ask them, do you have headaches too? Do you suffer from ear congestion? Do you suffer from back pain, neck pain, jaw, stiffness? All of these things. Basically, if the muscles must strain to get your teeth together, you set up a muscle-tooth war. In this war, 3 things happen. If muscles win, you have rapid tooth wear. If the teeth win, you have lots of muscle tension and stress and pain, and no wear at all. Or worse, there's a combination of both usually. And if you've got uneven muscle tension, what it tends to do then is tends to pull the head off balance of the atlas, okay? And it starts to cause a head tilt. And we're symmetrical beings. We like to be upright. So if one thing's tilted one way, we compensate by tilting the other thing the other way, and it tends to curve the whole spine all the way down. So it's a kinetic chain. And the jaw joint being the top joint in the body, if that's out of balance, and it's the only joint that actually goes across. So if one side if it's rotated, it affects the other side in the opposite way. So, it contorts the whole body all the way down. So diagnosis begins at homeostasis. So our treatment goal is to really get the body stabilized. Number 2 then is to then make the teeth match what the body needs. That's how I tend to approach things. Okay. So the basic fundamentals of a good occlusion would be homeostasis of TMJs, and a complete postural system is critical, so including head, neck, shoulders, and mandible. Establishing a myocentric or physiologic position in space is crucial for the terminal contact management stability. The occlusal plane angle should be anatomically orientated, not flat, to support proper head and neck posture. So we really want the angle of the jaw here to be the same as what it is in the if we're mounting something in the lab, we want to make sure that we actually record that, the angle that it is in the mouth or in the head. Anterior contact should be light but not entrapping of physiologic closure pattern of the mandible, and the canine rise should support posterior disclusion. Lateral excursive movements should not be restricted by posterior occlusal contacts, a proper curve of Wilson, and protrusive and retrusive contacts should be balanced. So what we do then is we obviously gather the data and take the necessary x-rays and cone beams that we need, and having a look at the signs and symptoms, and then getting the necessary data of the human articulator to put in a computer. And what we also do, I take EMGs of all the muscles in the head and neck region. What we can see here, so the LTA and RTA, they're actually the temporalis. LMM, RMM, they're the masseters. Then going down to the temporalis posterior, they're the neck muscles, and then the digastrics, which are down here. Okay, so you can see this is a girl who suffered really bad headaches every day, to a point where she was bedridden. She couldn't get out of bed in the morning, and her parents had brought her to, she was only 21, her parents brought her to every neurologist there was in town. And in the end, they gave her endone and endep, said to her that she's just a silly young girl making up stories to get attention, and that she was lazy, she didn't want to go to uni because she couldn't go to uni, and she just had really bad headaches. And you can see the RTA and LTA are already at rest. They are higher than everything else. Okay, now we did some clench tests on her, so you can see when she clenches her teeth, the masseters, which are down here, the green and the purple, they're hardly firing at all. They're very fatigued. But when she clenches, her temporalis fires greatly, okay? So she clenches her teeth all night. She has had a splint since she was 18 and she clenches, but they completely disregarded that. So what we did was we used the neurotransmitter, the TENS, is a transcutaneous, so it's a neurotransmitter. What it does, it pumps waste away from the muscles and all the lactic acid. It increases blood flow, oxygen, ATP, all the good things that it needs. And it changes muscle metabolism from anaerobic to aerobic again, and it has endorphin effects. So in fact, people feel really great after doing this. Okay, so we do that for about an hour. And then these are her muscles immediately after TENS. And you can see everything is back down to really calm and baby's muscles again. Okay, and what we did then here, we got her to rest her jaw apart, so we see what the muscles are responding at, and then we get her to then close her teeth lightly into CO. And that's what her head did. Look at her head muscles in CO. So I can say, well, I can see the bite and the clenching is causing your muscles to really fire at night. It's very clear to me. And what the neurotransmitter also does, because it causes natural contractions, we actually plot that direction in a graph. You can see here, I don't know if you can see, these here, that's the TENS bite. That's the TENS just moving the jaw. And the big one there, that's her going tap, 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 biting on her CO. So her jaw wants to be here. That's where the muscles want to be. But her bite makes her up there. Okay, so that's actually the difference in the pathway between where her jaw and her muscles want to be versus where her bite and her teeth make her sit. So actually, I'll go back again. So you can see what I did then, those points there where the pink dots is where I tried to take a new bite. Okay, so I take a bite around where her muscles want to be, not where her teeth.